Hello everyone, my name is Arola Hassanai and I'm a student at Middlesex University, currently in the sports rehab master's degree, and placement was a part of my program. So I did two different placements. Medicine, which is a physiotherapy clinic, and the next one is the fitness pod at Middlesex University, the gym. And I am a physiotherapist, so I have a bachelor's in physiotherapy. So for me, it was the things that I saw there, the cases, it was not new to me, but there are a lot of things that I still learned from the supervisor. First of all, I learned more about acupuncture, electroacupuncture, and other modalities. This is because the physiotherapist there, the lead physiotherapist, was qualified in acupuncture and also electroacupuncture. And then it was new to me taking client information and notes and uploading them to different cases. Coming to the third point, the differences between private clients and non-private clients. By this, I mean that in the clinic, which is the physiomedicine, which is a private clinic, in this clinic there were private and non-private clients. So the private clients had different report templates than the non-private ones, because the non-private clients were from insurance companies and everything was different. You were supposed to upload the reports with all the notes and the exercises and everything the physiotherapist did, and then when you submit it in each patient's a different portal that they have for the insurance companies, and based on that it was how the company was getting clients. So that was new for me. I didn't know how to do the reports for the insurances. And also the way a physiotherapy clinic runs, everything starting from the receptionist, the lead physiotherapist, and then being able to communicate with the manager and also the team there, for example the sports massage therapists and all. And then during this 4-week placement, I became better at communicating with clients and making sure they are always safe and being listened to. So a big key is knowing how to talk to patients and making them feel understood and also listened to. And for example, there were a bunch of cases when I had to improvise and also learned new things on how to communicate with patients in the cases when the physiotherapist was late or there was something wrong with their booking and appointments. So I always had to know how to talk to them in a sweet and kind way, so they don't feel bad or they don't feel like they're being left out. Fitness pod at the Middlesex University. This is completely new for me because it's a gym and I'm a physiotherapist and I've never worked in a gym other than working out for myself. And the things I learned there were quite a lot. First thing I learned was the way a personal trainer conducts the first appointment for a new client, and including the examination tests and talking to them about their issues and what they want to fix for their bodies and what their goals are, fitness based. And then also I learned how important and beneficial a personal trainer is, both for the mental and physical aspect. There were a bunch of times, I've mentioned this in my weekly reflective vlogs, about how it can really change the perspective of going to the gym. They can motivate you a lot more, and then they just make you go through the workout, even in the days when you don't want to. And then also personal trainers, they all have different ways of motivating and coaching the clients. Some of them like to shout because that's how it works with their clients. Some of them don't, and it works quite well for them. And then my last point is like how crucial it is to know what the client wants, and how important it is for the personal trainer to understand their goals and giving realistic goals for them, and giving them in a time which is going to be, again, realistic to achieve that. The client for this case study is from the clinic at the fitness spot. His name is Ben. He's 40 years old, is male, the height and the weight, and then he's the fitness spot manager, and he likes to play football as a hobby only once a week. And then for training, he cycles to work 2 to 3 times per week, and that lasts him 45 minutes. So when the client first came to the gym, this is the only client I had a first appointment with, so I was there. And I just want to say that in this gym, since I have no qualification regarding personal trainer qualification, I was not allowed to touch or to be alone with the patient, so I only had to observe and shadow the personal trainer. So the client reported an issue concerning their hip area. They said their hip and leg muscles were tight and sometimes it caused them pain. And they also had mobility issues. And then he feels like he was less flexible than before. And he also noticed that while playing football, because as I said, he plays football once a week, and then his goals were to improve mobility, flexibility, and range of motion. This still considering the fact that he wants to play football and be flexible like he was before. He also wants to start strength training and prevent injuries. In this first appointment, the personal trainer, after talking to the client, talking about his concerns and what his goals were in the gym, he then started to examine him. And the things that he did that day were the Faber's test, which he used in order to detect the hip or the sacroiliac joint pathology. This is in a study from Ahmad et al. In 2023. And then he also did the straight leg raise test for the diagnosis of either sciatica or lumbar disc hernia, which is also mentioned in a study from Pesonen et al. In 2021. And both these tests were negative. And then the third thing he did was hip muscle, manual muscle testing, and also the range of motion. And both of these may evoke useful information regarding hip issues, according to Bird in a study that he did in 2007. After that, in the next slide, I will show the range of motion for the hip, the flexion with the knee extended and the knee flexed, extension, adduction, and abduction were like this. And the personal trainer noticed that the right side had a more restricted range of motion. For the manual muscle testing, he tested hip flexion, extension, adduction, abduction, and also the core strength. And it's in a grade 4, which means the muscles breaks away using only a small resistance. So we can go against gravity, but when a small resistance is applied, then the muscle breaks away. This is from a study from Konabo et al. In 2011. And then after this examination, he delivered a program, and the program is this. I took a picture that day because I wanted to study like when I went home, because for this program he said the client is going to do it for minimum 4 weeks, and then here's going to do it as long as the client is feeling better and doing these exercises better, and he was going to do this 2 to 3 times per week. So as we see here, we have a lot of isometric stick holds, foam roller squeeze, hip depressions, we have quadratus lumborum baby pose, and then we have hamstring spine stretch, seated glute stretch, and then lying side quad stretch. So most of these are based on a rehab program, and then when I asked him about research that can back this, he said that these were just exercises that are part of a rehab program, and that's why he used it for the client. But I found that isometric contraction exercises have a significant effect on patients with hip pain in a study, providing them with a higher range of motion, which is what the client initially wants. And this is in a study from John et al. In 1997. And then a combination of foam roller exercise and stretching exercises helps to increase the mobility in the hip range of motion as well. Et al. In 2014. So this was all the first examination and what the personal trainer did for this client in the 4 weeks that I was there. So in total, I saw this client for 5 times, including the initial assessment. And then what I did is that I kept asking a lot of questions to the personal trainer, why you did this and why you did that, and why would you not do strength training and stuff. And then he said that he would start strength training once that the client gets better at this, so maybe 1 month or 1.5 months after. And then he thought I was asking a lot of questions, and then he said, if this was you, what would you do? And then I said that I would add a manual muscle testing and a range of motion evaluation for the ankle joint as well, because all of these sessions that I had and where I shadowed the supervisor, I saw that the client had flat feet, and also he kept mentioning about how his calf muscles are always tight and they hurt sometimes. And then I would do an overhead squat and single leg squat assessment, like we learned in the master's program, which is really good. It's a really great way to fully examine the body movements and look for compensations, and then write a program that includes both stretches but also strength training exercises for a faster recovery and a faster way to reach his goals. This is the overhead squat assessment. I had to cover his face for privacy issues. I did the anterior and lateral and then posterior. These are screenshots from the video. In the lateral view, we have compensation for excessive forward lean, and then in posterior we have feet flatten, which I also saw before doing this. Mind you, these videos were taken after they had a session. The personal trainer gave me the permission to do this, and he said that I could give him the program that I was going to do based on these videos, but after he is done with this rehab program, so 1 month ago. But unfortunately I was out of placement by that time. Then in the posterior we have an asymmetrical weight shift. Single leg squat assessment, as we see, knees move. That's the compensation, and also we have a hip drop. So in all of these we see that we have tight adductor complex, we have tight gastrocnemius, tight soleus, we have tight abdominal complex as well. Now what I did is I came up with a corrective exercise plan, and this is based on the NASM template. And I started, so this is the first phase, the stabilization endurance phase, and then I started with a warm-up, which is a bike, and the client can do that for 5 minutes. And then we go into stretches. These stretches are based on the NASM template. We have the gastrocnemius and soleus, adductor TFL also, and then for a static stretch, gastrocnemius, adductor complex, TFL standing stretch, and hamstring stretch. And these are all based on the overhead squat and single leg squat compensations. Then we go into activation and core and balance. As we saw, they have a weak core, so I suggested bird dog, floor cobra, and single leg balance excursion because they had difficulty balancing. And this the bird dog is 2 sets, floor cobra and single leg are 1 set for 20 seconds. The movements are slowed and controlled. And then for a skill development and plyometrics, I suggested box jump and alternating split squat jump. According to Shankar in 2008, he said in a study that the results show a significant difference in vertical jump height, so regarding he plays football, when he combined the split squat in a program. Lastly, we have the resistance training, and for this I suggested calf rises, glute bridge, goblet squat, leg press, squat to shoulder press, weighted lateral lunges. Most of all are squats because I forgot to mention, but in the overhead squat assessment you can see the lack of squat depth, so I really wanted to work on that. And then according to Toby on 2018, in a study that he did, he said that glute bridge exercises are great for strengthening the hip extensors, because from the assessment we can tell that his hip flexors are tight, so we need to work on the hip extensors. And then for the goblet squat, there was a study from Berda al in 2012 saying that it is really great for the excessive forward lean. And during the squat, it means that the trunk is positioned throughout the goblet squat and creates an upright posture during the downward movement. So that means this is going to help with his forward excess leaning. And then for the weighted lateral lunges, according to Keogh, as a consequence of a lack of anterior and posterior movements, so it's not a forward lunge, it's a lateral lunge. This means that it's going to cause a greater stress in the adductors and the abductors than a forward lunge, and this can be used for injury prevention and also as a specific approach for clients that want to have greater strength, flexibility, and stability in the lower body and torso. And then for the squat to shoulder press, it's a great combination, and this is based on the NASM template. And for the cool down, the client is going to do the warm-up again. Placement case study. I decided to do this for the client in the fitness pod because I wanted to challenge myself, and also I wanted to put to practice all the things that we learned as a theory in the masters. And if I did it for a physiotherapy client, I think that would have been a bit easy, but the things I learned about the gym were great. It's learned how clients and personal trainers bond, and how talking to them, having this communication skill, and also at a comfortable and confident level with the client, really just impact their training. And then, as I said in the beginning, having a personal trainer increases the chances of having a better session in general. But also in my first placement in the physiotherapy clinic, it was great knowing a lot and going in detail more about the electroacupuncture and how it differs from the normal acupuncture. And also my supervisor, the lead physiotherapist, was always researching for newer techniques and what the studies were saying, and everything she did for her clients was all always backed by research. So overall, it was a great experience, and I learned a lot of new things. Thank you for listening.